The following program contains mature subject matter. Viewer discretion is advised.
Nobody wants to see a drug-addicted baby. And so I understand and I appreciate that. However, as an OB-GYN, my concern is there are other means of birth control that are as effective as having your tubes tied, but they are readily reversible. So I know that you offer both options to women, so they can either go with sterilization, which is permanent, versus something like a Nexplanon, which is the device that goes under the skin for 3 years, or an IUD, one of which can last for 3 to 5 years and another for 10 years. Yes. So how about focusing just on long-acting reversible contraception as opposed to sterilizations? Why are you sterilizing these women? Let's fast forward 10 years, 20 years, when they are clean and sober. Are you saying that a clean and sober woman no longer deserves to have that option?
I think it's their choice what type of birth control they want. I chose a tubal ligation after I had 3 children. They've had 3 to 13, and if they don't want any more children, that's their choice.
Do you think that's a great time for them to be making that decision?
That's between them and the doctor. I've had many women call and say the doctor would not give them a tubal ligation because they were not clean, we don't ask anybody to do anything. We just want them on long-term birth control. It's their choice.
You talk about choice, you're talking about women on drugs, many of whom have psychological issues, mental health issues, so are they really making a choice?
But you're focusing on the rights of the woman. This is not about the women to me. This is about the innocent children who don't have a choice to be born damaged.
Barbara, there's so many ways that we can...
It's not about the women.
Let's deal with the addiction of the women. So don't make this a binary choice.
If you believe that the women have rights to procreate, that's fine, but I do not believe anybody has a right to destroy the lives of innocent children.
Barbara, you and I agree on that. You and I agree. I'm a mother of 3. I'm a children's rights advocate. I've spent my life advocating on behalf of children. But let's be clear, it's not a binary choice. It's not the rights of the women versus the rights of the children. Let's invest some of that money in getting these women off drugs. How about that? Why don't we try to work on improving the system to help these women get off drugs so that they can be better parents and better mothers to their children?
I've had many people say, why don't you spend your money on drug treatment? That's not what we do.
Given the history of sterilization in this country, it's a big problem.
So if I may just interject a little bit, I think, you know, in psychiatry, unfortunately, I see the repercussions of children that are born to females that were addicted in utero, and there are a lot of developmental delays and issues, and I do want to just support you, somewhat in what you're saying, because that all makes sense. From a psychiatric perspective, I do capacity evaluations at the hospital, and the capacity evaluation, for those of you that don't know, is can this person make a decision in the frame of mind that they're in to go through with a medical procedure. And in a lot of cases, when someone is intoxicated, in those cases, they're not in the frame of mind to make a decision to have that procedure.
Why can't you just say, let's do long-acting reversible contraception? I would commend you for that program. So why not take sterilization off of the table?
Because many of the women don't want to have any more children. They've had 3 to 13 children, and they don't want any more children. And to the doctor, I always say, if you can't trust them with a choice, how can you trust them with a child?
What percentage of women will choose sterilization, approximately?
Well, I want to say maybe I don't have the stat, maybe a quarter.
And how many of these women, Barbara, that see doctors are given an option, as Dr. Nita talked about, for long-term birth control? Do you know what percentage are actually choosing long-term birth control versus sterilization?
Most of them are choosing long-term birth control because they're younger and they might want to get clean one day. Hopefully that's the goal. Everybody wants them to get clean, but the reality is many of them won't.